Hi, everyone. Let's continue our talk about Chinese medicine dermatology. Today's topic is acne. Acne is one of the most common skin conditions. So it's a big topic in dermatology. And also, that's why I put it at first. Now let's look at the slide. Acne or acne vulgaris is very common. About 80% of people develop some kind of acne in their life. Occasionally, acne relate to underlying endocrinological abnormalities, which we call secondary acne. In Western medicine, Western medicine is also developing their recognition about acne. When I was teaching, I found this information. It said diet plays no roles at all. Hourly washing doesn't make difference. Hormones are normally normal. That was in year 2007. But 5 years later, I also found something different. It said hormone plays a significant role. Diet, including fatty and sugar intake, relates to the development of acne. Stress, genetics, and medications relate to the acne, and so on. So I think in the Western world, their theory is also developing. Let's just quickly go through. This secondary acne, it's not due to, it has different reason for the acne formulation. So we have to, as a practitioner, we need to keep this in mind. That's why we need to ask patients previous health histories and other health issues when we do the inquiry. Now let's come to the Chinese medicine. The clinical feature about acne is they commonly seen among adolescents and young adults. It may continue to adulthood. Lesions mostly appear on upper body. There are open comedones and closed comedones. A few people, mainly males, can develop dark red nodules or cysts, where the lesions are deeper in the skin and often leave some scars. Patients normally don't have any other physical abnormalities. The pathogenesis for acne in Chinese medicine, actually they are quite few. If you read different books, maybe you'll find there are more, some books list more pathogenesis, but here I mainly talk about three. It's the most commonly seen and typical types. At the clinic, you see acne actually won't be exactly the same as this. Patient appears have different, sometimes different types on the same body. And the tan and the pose won't be so typical. We just do the treatment and diagnose following what we see. Okay, now the pathogenesis of acne, the first is lung heat due to upsurge body yang, binding the wind and or stomach heat, travel through meridians to upper body. can also pass the lung and create lung heat on the way and then cause acne. So that's why we see a lot of young, especially male people have acne. The reason for this is upper surge body young. The young male often have strong yang in the body, and then it can combine other things together because yang is heat in nature and goes upward and then cause acne. Wrong food is second pathogenesis. Wrong food produce heat and or dampness. After a certain amount of time, dampness change to damp heat, goes up body. Heat has a nature goes up, so goes to the upper body, created acne. The next one is spleen qi deficiency, cause dampness retention. After a certain time, transform into damp heat, then to flame heat. Flame heat upsurge, go to the upper body, form acne. And then also flame heat block channels to form those cysts and nodules. Here is the simple summarize for the pathogenesis. Now let's look at the patterns, identification, and treatment. For the lung and the stomach heat type, the acne normally is small red papules with blackheads and spread on the face, chest, and upper back. Patients often have oily and shiny faces, dry mouth, dry stool, and yellow urine. Red tongue with thin yellow coating is often seen. The pulse is slippery and fast. As I said before, some people can be very typical lung and stomach heat. Some people probably is not so typical, not so obvious. You won't find the tongues really red, or maybe the pulse is only fast, not so slippery. So you have to use your knowledge, your judgment to diagnose correctly. For lung and stomach heat, we use formula 枇杷清肺饮. Pipa is a fruit. 枇杷清肺饮 has 枇杷叶、桑白皮、黄芩、黄连、黄柏、知母、生石膏、生地、牡丹皮. This is the formula we modify on the base of this main formula. So if someone has a lot of pus, we can add 紫花地丁、败酱草. If people have dry mouth, then we add 麦冬天花粉. For dry stool, we can add 大青叶、大黄. If the acne become more severe before period, we add 香附、益母草、当归、白芍. Now, the second type of acne is damp flame plus blood stasis. The pimple appears dark red, long-lasting. Some have nodules or cysts. Dark purple, scar left after eruption. Rough and unsmooth skin. The tongue is dark red with yellow thick coating. The pulse is deep, soggy, or soft and thin. As I said, some people may not be very typical flame, damp flame plus blood stasis. They may be in the middle of the lung heat and the damp flame, or combine the both. So we can, when you form your formula, you can modify according to your diagnosis. The treatment principle for this type of acne is move the blood, dissolve stasis, disperse flame, and soften hardness. The formula we use is 桃仁四物汤. 桃仁素汤 has 桃仁、红花、赤芍、白芍、当归、生地、牡丹皮、丹参. And then we modify following the patient's condition. If patient has a lot of cysts, we add 贝母、皂角刺、野菊花. If patient has hard nodules, we can add 皂角刺、夏枯草. This a little bit. 王部流行子. Sorry about this. The screen is covered. The third type is damp heat retention. This type of acne appears red, swelling, sometimes painful, some with pus. The patient has smelly mouth, constipation, yellow urine. The tongue is red with thick yellow coating. The pulse is fast and slippery. Again, patient may not have all of them. Maybe they don't have constipation. Maybe they don't have very bad smelly mouths, but you can diagnose, follow your history inquiry. Now, the treatment principle is clear damp heat. The formula we use here is 龙胆泻肝汤. We modify it following the symptom. For constipation, we can add 大黄. Oily skin, we can add 山楂、炒枳壳 to promote spleen movement. For irregular period, we can add 益母草、香附. Now, external treatment. Chinese herbal medicine external treatment is good, but for some people, they may not accept. I only pass the knowledge here. Whether you use it to your patient or not, it's according to your clinic and your patient. Because all this 洗剂, like washing liquid and ointment, they all yellow. Whether patient like to put them on and then wash off, it's sometimes it's difficult. And for practitioner also, if you only mix this little bit for one patient, sometimes you may not worth to do because it's only a little bit amount. Okay, for lesion appear mainly as papules with a few pustules, we apply 四黄洗剂. It's in English, it means 3 yellow wash. It has 黄柏、黄芩、大黄、苦参. We have 10 to 15 grams of herbs, of each herbs, and then add 100 ml sterilized water, put on skin with cotton buds, and then we shake the liquid each time before apply, 4 to 5 times a day. As I said, this 3 Huang wash is yellow in color. If you apply on the face 4 to 5 times a day, whether it's practical or not, it's an issue. For lesion manifesting mainly as nodules, cysts, and scars, we apply 四黄膏, 4 yellow paste, 大黄、黄连、黄芩、黄柏、芙蓉叶, 30 grams of each, mixed with 500 grams of warm sesame oil or melted yellow wax. For chronic type of acne, we use 颠倒散. We use equal amount of 大黄 and 硫磺 powder. 硫磺 actually is not allowed to be used in Australia, so we leave this one. Acupuncture, if patient can afford, we can combine with acupuncture. We use last intestine points, dew and bladder meridians. You can study this by yourself. And one important thing, and also it's Chinese medicine character, if lifestyle advice. We advise patient cut down fatty and spicy food and sweets. Eat more vegetables and fruit. Wash face with warm water and soap a few times a day, according to how bad is your acne. And do not rub or press or even squeeze the acne with hands, especially dirty hands. Avoid cosmetic products. And we also advise patients to do their stress management. Acne has strong relationship with stress. Dietary advice, as I said before, is character of Chinese medicine. Generally, for oily skin people, we tell them to have plain, cooling, or neutral natured food. Avoid food in warm or hot nature. So dietary advice, as I said, this talk is mainly for students and the new graduates. So you have already learned the nature of the food. So I'm not going to repeat that. I assumed you understand already the nature of the food, the cool, the warm, the hot. So I won't repeat them. For the dry skin people, we should have more neutral natured food, and sometimes can take warm or hot natured food. However, there's no absolute. For toxic heat, we can advise them to have plain food, cold or cool nature food. For internal or external cold, we'll advise them to take warm or hot natured or neutral natured food. For the strong itchiness, we tell them to avoid pungent, spicy, or hot natured food. For heat or indeficiency patient, we tell them to avoid pungent and hot food. Take more cooling in nature or cold nature food. For dampness related skin problem, we advise them take light food, not heavy or greasy kind of food. More vegetable fruits, congee with 薏仁 and 陈皮. Avoid sweet and greasy food. Now we have to mention one thing about seafood. In Chinese medicine, we believe seafood can exacerbate skin conditions. So far, I haven't found any satisfactory explanation about this. This is just after thousands of years of observation and experience summarized. So we need to just mention it here. Okay, food, nature, I list some here, but I'm not going to race through them. They take a lot of time. And then you can stop the screen to read, to find if you're really interested. Okay. Next time we'll talk about acne rosacea. For this talk, we will finish here. Thank you. I'll see you next time. Goodbye.